The limitations are the volume. The more volume you put in, the more chance of complications. Small amount of filler will not give the result you want. You put too much filler, the risk of inflammation and infection increases. The other limitations are that you get lumps and bumps. As soon as you start using threads, and I'm talking about polydioxanone threads, you have a much better safety record. The threads will give you an immediate effect. How much volume you got, you can see the curvature of the butt. The real effects come a few days later, and even a few weeks later. The main reasons for doing threads would be their safety. The training for using threads is different from other areas because, first of all, we have a larger volume, and therefore the delegates have to understand different vectors that are involved. The main misunderstanding that practitioners have is that you're going to get surgical results. You're not going to get results like they're doing surgery. Many of them are a bit apprehensive of doing fillers because of the recent complication cases that have been in the news. You don't have to worry about complications. You don't have to worry about someone having a cardiac issue because the threads don't do any of that. One of the key effects is that if there are any areas that are not quite smooth or you haven't quite got the lift that you want, you can just touch up with a filler. And I think there is an indication for using a small amount of HA filler, in other words, a safe amount in combination with threads. And if it's done by suitably qualified medical professionals with the expertise to do it, I think that combination technique is superior to doing them either filler or doing either thread by themselves. In the gluteal region, the safety issues are infection. In most of these procedures, you get bruising, you get swelling, you get some pain. But infection is the big one. Post-operative care is very important. The patient should know how to look after the work that they had done. Provided the post-operative care is good, then I think the results and complications can be very low. So when we're using PDO threads, they will get a good result, but it's important to tell the patient that the final result may take 2 to 3 months due to secondary collagen formation. But maybe in 2 months or 10 weeks, we may need to touch it up with another thread, and so the final result may be in 3 months' time. People are becoming more aware that these are available. I think in the past, people didn't realize there were non-surgical options. But as people and the marketing goes in ahead and patients, it generates patient demand. The main thing I want them to take away is that if they're properly trained, if they have the proper anatomical knowledge, if they have the proper skills, this is a procedure they can routinely do, and it will help their clinic, grow their clinic, and get more satisfied patients.